Hey, everybody. We are ready. I'm here with
Yes.
Kaja, which is exciting. I know that you guys have a gazillion questions for her, and I just want to kind of offer a frame for this Ask Me Anything because you guys know that I personally have Epstein-Barr. And what that looked like for me, I actually think that Epstein-Barr is was the linchpin in all of my issues. um, I did a lot of things to make adjustments to my diet, to my environment, and all of those things, they matter. They're important. Like, you have to do them. But for me, until I really got into the protocol that I personally did and began eradicating Epstein-Barr,
Mhm.
I was only going to see limited success because this virus has likely been in my system for 30 years plus. I'm 43, and has really, really taken a toll
Yeah.
on me. And my immune system was very suppressed. I have noticed a fabulous increase in energy, which is just fantastic. I've noticed that even on nights when I don't get enough sleep, I try to be in bed around 10 and definitely go for 8 or 9 hours of sleep a night. But even on nights when I get 6 or 7 hours, I'm okay the next day. Like, I'm not waking up the next day feeling completely like I did not get all my sleep, you know?
Yeah.
And that's really nice because even though I practice getting good sleep, life happens sometimes. And it's really beautiful to not feel like my entire life has been completely derailed because I missed 1 or 2 hours of sleep or I got to bed too late, I just can't say enough about how important I think it is for every woman to get tested. Over 90% of us have it. I also want to say one other thing about this. A lot of women, I think, feel guilt that they had Epstein-Barr, didn't get it treated, have a child, and now their child has Epstein-Barr. And I just want to say that 90% of the population has it. This is chronic everywhere. And I think as a woman, you should really cut yourself some slack, give yourself a break, because 90% of the population has it. The chances of them getting it, even if you hadn't passed it to them, to your child, are super, super high.
Yeah.
So let's take a really proactive approach to this and let's talk about what we need to do to eradicate it, to lower or get rid completely of this virus. And I'm so excited for this Ask Me Anything. It's going to be great. And I get to hijack the first question. It's not even on the list.
Okay.
What I would like to know is, do you believe it's possible to completely get rid of this virus, or are we simply in management mode of this virus for the rest of our lives?
Okay, great question. So, I see that people are greatly attached to the numbers of their antibodies, and I see that all the time. I'm freaking out. I'm doing this and this, and my numbers are not budging, and so on and so forth. So, what does that mean? Does it mean the virus is still there? And um, the thing is, once you have the virus, I think it's a terrain issue. It's a makeup. We are hosts, and it's not. We like to kill things, and go and wipe them out. That's what antibiotics do, right? And it's not always a pretty picture. Um, and so I would say, with what I've seen, the healing from it is possible. And I don't like the word management, because management means that you have a disease and just manage it, and that it doesn't work this way. You can completely heal it. Shall I read that note that I just got from my graduate? I think I shared it with you because it just warmed my heart. This is what you want to see. Um, I'm just gonna read it to you. So one of my chronic EBV cases gave me some miracle news. Thyroid nodules and inflammation completely resolved. Her doc had to take her glasses off. She couldn't believe the ultrasound results. We're not even looking at the antibodies here to EBV. We're actually looking at thyroid presentation. So, and if that person were to look at the antibodies and they were still elevated, or some of them, what would they think? Would you flip and think, I still have EBV, I'm sick? Because the point is, the EBV stays with us until we die, just like other bacteria, fungi. We are hosts, but the point is that you can live your life completely, fully, without any symptoms. without any flare-ups, eat what you want, live the way you want, and just pay attention. And my goal is to create an environment where in future EBV will be just like a cold. People will know what to do. It's
Yeah.
not a big deal. And this is
Yeah.
what I see with my patients when they recover, when there's no complications. If it's just being everything has been driven by EBV, it's not a big deal. If there is a sniffle, they get on it. One day they're back on, and nothing ever comes to anything. So you're basically preventing replication, preventing any further damage. You can support the infected cells with some nutrients. So it's a gray area, and I can't make claims that you cure it. Dr. Flavin made claims, and I actually put her study in there. There's a link in our thread. But the beautiful thing is that it is possible to just look at it like, I have a small sinus infection. I know what to do. I have a little sore throat. Just like with sore throat, you can take some aloe vera, it's antimicrobial, and suddenly there's no problem, right? That's what we want. We want to get this message so people don't, it is a big deal, but you can, when you understand how it works and how predictable it is, like in your case, you're no longer scared. It's not an unknown, and you know what to do with it.
Yeah.
And just like that. So you shrink its power over you. It's just one aspect of your life. So, if you go outside and the forest is burning, now you know that dioxins can reactivate it. So you're going to have a mask on you and stay at home, and you won't get sick.
Yeah. So one of the things that I like in this too is the whole yeast conversation, because we talk a lot about yeast overgrowth and people have issues with yeast overgrowth. The goal is to get rid of the overgrowth part, but we're not going to get rid of yeast entirely, nor should we. So what's inside of our bodies is an ecosystem in there,
Yes, it's a terrain.
I can't speak to this because I don't remember specifics, but in my talk with Ryan Freisinger, which if you purchased the summit, it was one of the bonus talks. And Ryan is amazing. He actually talks about, briefly, the role that EBV actually plays in the ecosystem that's positive. And I don't remember it. I wish I did. Maybe I'll go back and listen to the talk and then come back and put a comment on this thread. But I encourage everyone to listen to that talk if you just want to understand this better. I see that with a lot of issues, not just with this Epstein-Barr issues, but with a lot of issues, there's this part of us that wants to completely get rid of it. And I even see with thyroid, like I want to get to the point where I'm off thyroid meds. I want to get to the point where I'm off hormones. And maybe you will. Maybe you'll get to the point, like if you need that support, where you won't have it. I certainly aspire to that one day. But am I going to feel like in my health journey, I'm not as successful if I have to stay on thyroid meds my whole life? Absolutely not. The win for me is being symptom-free. The win for me is I'm not flabby, foggy, and fatigued. If I have a great quality of life, if I feel energetic and fit and strong, and I'm able to create the life that I want and show up for the things that matter in my life, if I'm able to apply myself in my career and achieve the level of success I want, if I'm able to create fabulous relationships and be there for my family and contribute, then I'm winning. And that's really what I want us all to focus on as a community, not getting so in the weeds about health goals that aren't really health goals. It's not having all of your numbers at 0 for EBV really is not a health goal. A health goal is how you're feeling and what your symptoms are like. So I'm just offering that as a reframe to you so that you can navigate this journey in a way that you're going to truly achieve the success that you want. Because what if you got all your numbers to 0 on EBV and you still felt like shit? Are you winning? Is that the outcome that you really wanted to create? Okay, let's get on to the questions, because we have a lot of questions.
Well, let me just address what you said. I love what you say. I agree completely. I love when you said show up for things that matter in your life. But the thing that matters the most is, I'm speaking to the ladies now, look me in the eye. You matter, and you're worth it, and you're good enough. That's often at the bottom of trying to control and get the numbers and tweak and this, because you're trying to control something. If you let go and really trust that you're worth it, then you can relax and think about what matters in my life, just like Missy said. What matters? And you matter. That's where we have to start.
Absolutely.
Let's get
okay. First question is from Bethany. Is it true that EBV, Epstein-Barr virus, I'm going to call it EBV, but just in case that's not clear, Is it true that EBV is the cause of hepatitis C?
I don't know the answer to this question. There are claims. So, no, many of the viewers probably are familiar with Anthony William and his books. He makes a lot of claims. He talks about hepatitis and Epstein-Barr. Um, I would say I would pursue that avenue, definitely, and see how you respond if you follow that path. Just see how the liver does. See what presents if you get on it. Mm-hmm.
One of the things I will say in my experience on this journey, and I'm speaking as a woman who has been in this space for a long time, you guys know that I've got a lot of access to really smart people that I'm constantly learning from. This idea that A causes B is a fallacy. In my observation, we so want to find a cause for things. A contributes to B is likely more accurate. A causes B is, you can't say that definitively, because for some people A might cause B, but for other people A doesn't cause B. You know what I mean? So if you can't draw a scientific correlation, this always leads to this, then it's a maybe. And if it's a maybe, then the most you can say is this is a causative factor. So like, why am I tired? I'm not tired because of Epstein-Barr alone. You know, I had Epstein-Barr for a really long time and I wasn't tired. So you see what I'm saying there? Like, kind of shift your thinking a little bit, and then it's easier to wrap your head around this stuff. That's why I'm offering that. Because does Epstein-Barr cause hepatitis C? There's nothing in the data or literature that definitively says that it does. However, could it be a causative factor, meaning this in combination with other things in the body contributed to a state where hepatitis C was able to manifest? That's more likely the case, for whatever that's worth.
Thank you so much. I really appreciate this. You just rescued me. Yeah, you can have a headache. And if somebody asks me why I have a headache, well, there can be probably 15,000 different reasons, and it depends on the person. That's why people with EBV have different presentations. Right. Definitely. But I had a case when a woman was vaccinated for hepatitis B, and within months she developed liver damage and cirrhosis, literally almost, and hepatitis B. I mean, you know, we're also over-vaccinated. Who knows? It's complicated, but you have to look at your timeline in your life and get a hunch where things are trickling. What is your weakest link? Where do you get sick? What would it be?
Yeah. Alrighty. Joe Carroll asks, my primary told me that I had EBV at one time, but not now from my lab. So I guess her labs are not showing now. But I also read that it hides in the body. So is there a way to know if I still have it? Great question.
Great question. Get this question all the time. The problem I'm seeing is with what doctors test and do not test. So there is a website, EBV Help, HELP, and one of the pages has an extensive write-up on labs and lab interpretation and the markers and how to understand them. And if you take your lab result and look at that, did the doctor test all 4 markers? It's true that 2 of them are for chronic exposure. You have the antibodies, you've had exposure, but the problem with looking at this is that in medical community so far, EBV is only considered dangerous when it's in the acute phase, the first infection, so to speak, which is not always true, but called mononucleosis. And during that time, they can tell you that's what you have EBV. But after that, in their vocabulary, EBV is gone, you have antibodies, and it has no bearings on your future. And for some people, it may be so. You've had mono, and that's what it is. You have so much nutritional support, there's not enough stress, there's not enough triggers, and you don't have any conditions. You may not present EBV again for decades, depending on circumstances. But the EBV, the problem is that, let's say, if your doctor tested DNA, PCR, I think it's called, that will disappear within 2-4 weeks. DNA is only showing in the bloodstream during lysing, so the reactivation, the Some literature says that EBV reactivates spontaneously for no reason. That's completely wrong. There's always triggering point, But when the B cells, like B as in boy, your cells are infected and they're immortalized, so they always have that component of the virus in them. It changes the way they behave. And so they are tainted and they behave differently. And if you have triggering events in your life, those cells will burst, lyse, and you have spilling of new baby virions. That's when they get into the blood, and that's when that DNA testing will pick them up. But the problem with EBV is exactly that it leaves the bloodstream and then travels, whether it's thyroid, spleen, liver, brain, joints, muscles, connective tissue disorder. I have a case right now, and we're doing the applications for EBV, and things are improving. So it goes. So that's one pitfall for medical community. The other one is early antigen. Oftentimes they don't test for it. It's a little bit like testing for thyroid. They do 2, and that's it. You have no idea what's going on, right? Underneath.
Cool. Right.
The same here. So early antigen is the one marker that you don't want to skip, because early antigen will flare up enough to present positive if you test it during a flare up. So here's a story. You want to think about your circumstance. One of my graduates from my clinician program said, well, the woman has the markers and the past exposure is positive, but the early antigen is negative. But she has all the presentation, all the chronic illnesses, all that, and Hashimoto's and whatnot. So what do we do with this? Well, I said, when did she test? Well, she tested in December. So then, when did she feel really like crap? When was this time when she was hit by a truck? Just that's how you feel, right? You remember how you used to feel, Misty?
Mm-hmm. Yeah.
When was that? And she said, oh, that was during Thanksgiving. But she tested in December. So by the time she tested, the lysing had already occurred. The virions were spilling. By that time, they were already getting out of the blood, into the tissues, they were leaving the bloodstream. So antibodies wouldn't pick them up necessarily. So what do you do with that? You're looking at your timeline and see, I would recommend reading the book just because that foundation part about research helps a lot of people with their own timeline of their story. I've had so many people say they have aha moments. Oh, I remember something happened when I had juvenile arthritis and nobody knew what that is. And I had this. I never thought about that because it was a mystery. And suddenly when you start reading, it can do this, it can do that. The whole picture makes more sense. Your symptoms in the past make more sense. And then the cycles of when you may reactivate or not. Does it make sense?
Yeah, totally. So the next question is you just said that perfectly. This is from Melinda. What are the 4 lab tests to check for EBV?
VCA IgG, and that is for life. That's going to be flagged for life. VCA IgG is the biggest one where people have 600, or if you have a marker more than 600, that commonly occurs if the lab only tracks the numbers up to this point. This is the biggest one, and this is the one that frustrates people. So I want you guys to hear me on that. If you get results, if you feel better, just like Misty said, you can sleep a little less and get away with it, and you can live your life again. And if you retest VCIgG and it's still more than 600, what are you going to do? Think about it. It could have been 5,000, and right now it may have dropped to 605. Huge drop, but you wouldn't know it. So you don't want to get stuck if you maxed it because you don't have a number. So that's very important. That really tips people over and discourages them, and you just have to remember that. The other one is VCA-IgM. VCA-IgM is more the initial infection, although I've seen just a handful of people, just very small percentage of people who actually flare up every time they flare up, or they have it elevated every time they test. It's hard to tell if they have it constantly up or if they reactivate so often. It's unusual for it to reactivate enough to flare up positive, but there are some irregularity. On that website that I mentioned, there are different scenarios. You can read, what if I have positive this, what if I have this, because antibodies are irregular as well. Like 10% of people don't make this kind of antibody, or it could be false positive. So the third one is early antigen. Like I mentioned, early antigen D, EAD, IgG. And that's the one that will tell you, you have to be smart about when you test. So run to the doctor or go online, direct to consumer labs, like Request a Test is one of them, and get it tested right away when you feel the worst, because if early antigen is flagged, then you know that's what's causing it. But you can miss it. So if it's negative already, but you have a history, just be smarter about when you test. And then the fourth one is EBNA, so nuclear antigen. That's IgG as well, and that's also one that will probably stay around for the rest of your life. And sometimes those two, VCA IgG and EBNA IgG, they remain high. Oftentimes in more severe cases, they are more than 600, so they're not flagging the numbers. So if you have that situation, really you want to look at other things until they start going below 600, so you actually have a number. But remember that it could have been 2,000, 3,000, 4,000. You don't know. Think about how you're improving and not the labs. And also think about other conditions you have. So thyroid is a perfect example, just like I read the message, because if you have Hashimoto's, if you're doing things right, and if EBV drives Hashimoto's, then the Hashimoto's antibodies will drop to normal. And that, like, those nodules suddenly completely resolved.
Mm-hmm.
So, yeah.
Okay, let's keep going here. We got lots of Hashimoto's questions too. This next question is from Nicole. I've tried taking lysine, but it upsets my stomach. I would love to try this protocol as I carry EBV, and this protocol sounds more reasonable than the expensive herbs my doctor had me on. Is there a replacement for the amino acid lysine?
There's so much you can pick from. And interestingly, lysine is not right. There's counterindications in the book where I have the whole protocol listed, and I have the potencies, counterindications, what to watch for. Gallbladder, high cholesterol, and hemochromatosis. These are not good options for lysine. So maybe you have hemochromatosis. Maybe you should do a complete iron panel and see if your ferritin is elevated, because that lysine improves the absorption of iron, so you may make yourself sicker. If you have high cholesterol, that may contribute even more, gallbladder. So there's plenty to go around. I like to use nutrients instead of herbs. I use just a few herbs, and I like to use herbs in herbal teas, because then you can focus on nutrient-based antivirals, which also feed other systems in your body, which is perfect. They do a lot of jobs. And then every time you drink liquid, you can drink water, but you can also drink water with antiviral qualities. So that's where I put most of the herbs. Mm-hmm. So there's plenty. You don't, if you don't do lysine, you do other things. Absolutely.
Yeah. Next question from Nicole. Can acupuncture improve or eradicate EBV?
Eradicate? I don't think so. But what it can do for you, most likely, if you have a smart acupuncturist, and they are smart people, is they will help the body turn off the stress hormones and the fight or flight sympathetic processes, because chemicals that are secreted during stress actually will feed the virus. So it's that would be wonderful.
I wanted to make that distinction earlier, so I'm glad you said this. Mm-hmm. So women understand, when you have a stressful event in your life, cortisol and all the chemicals in the body to deal with that stressful event is what feeds EBV. So during my cleansing protocol, I went through a stressful event. It was putting on Paleo FX, stressful time of the year for the entire team. And so we put that event on, and right after the event, I had the worst flare-up of Epstein-Barr. It was terrible.
Ooh.
But we were already kind of pulling the Epstein-Barr out. It was circulating in my blood. I had that stressful event. A flare-up's inevitable, right? So that's how these things are connected. This is why Epstein-Barr can like lay dormant for so long, and then a stressful event comes, and then you're crushed by it because it feeds the Epstein-Barr, which overtakes your immune system that can't fight off other things, and it just brings the whole house of cards.
Yeah. So while it's tragic, it's also predictable. It's like a switch. It's almost like you're pregnant or not. Like when you turn on the switch for stress response, you're on, but you can turn it off. And ladies, do you know how you turn it off in 5 seconds? Deep breaths. A couple of deep breaths turned off the sympathetic response almost instantaneously. And if you yawn, you know you've done it. So it's totally doable and it's predictable. Like if you have a situation like Misty and you know you're going to be going through cumulative event with a lot of stress, this is where you do acute EBV so you don't get into that place.
Mm-hmm. Awesome.
So it is predictable in that way.
Yeah. Mm-hmm. Great. All right. Next question's from Terry. How do I bring thyroid antibodies down? Mine are extremely high and have been for over a year, no matter what I do. I have been taking Mimosa pudica for over 2 years, which is for parasites, and started microbe formulas binders when they came out a year ago. I did a couple rounds of DMSA a year and a half ago. I see a naturopath monthly to help me with protocols. My diet is paleo. I'm unable to take iodine or thyroid meds. It makes me worse. Sensitive to everything. I'm better in some ways since starting Mimosa. Migraines are 80% better. Reactions are minimal. I have more energy, but my antibodies are high, and I found out that my EBV is active. I'm taking selenium, P5P, zinc, magnesium, TUDCA, which I had TUDCA is how she spelled it, as well as the microbe formula protocol.
So it sounds like there was a lot of antimicrobial activity from different formulations. So it's always hard on the body, I would think. This is what happens when you target EBV, but you don't target it strategically and you're not aggressive enough. So you can be on 200 micrograms of selenium, but if you really want to like strategically target right now what's going on, you could bring it up to 800 depending on your weight. If you're very petite, maybe 600. Drive it up to 8 and see if you can tolerate it. Research says it's safe up to this amount. Make sure there's no other selenium in other supplements, so you don't overdo more than 800. And you do the same with a couple of the big hitters that I mentioned in the book. And then you have to also look at the environment. If iodine is reactive, iodine is an antimicrobial. So is it because you're so toxic, or is it that you're sensitive to iodine, or do you not need it? Thyroid is like Velcro for toxins. And so you have to be aware of it. Even if you fly on a plane, you have to take measures not to have so much radiation. As simple as pat down instead of getting through the machine. So just being aware of your bearings with thyroid in general. But if you do the more acute protocol and then watch the antibodies, I see that if the EBV is driving it, these will start going down.
Awesome. Mm-hmm. Okay. Heidi asks, if you have SIBO and EBV, are the protocols the same? I know I have both. Which do I tackle first? Can your 30-day detox apply to both, Kasia?
Okay, do not do the 30-day detox. I think there is a button when you click on 30-day detox. I requested my IT guy to do a button. If you have SIBO, do not do it because it's going to tear you apart. I get a lot of cases of both, actually, to the point when I wrote an article on that EBV Help website about vagus nerve, SIBO, fibromyalgia, chronic fatigue. What the heck? The vagus nerve. So SIBO, I would say SIBO needs to be looked at first. I would say this. Whew, SIBO, in a way, EBV is more predictable and simpler. SIBO is much more complicated. I remember talking to our SIBO guru, Angie Pfeiffer, a good friend of mine, and says, I wish SIBO was as simple and straightforward as this. So if you've had SIBO, you know what I mean. But also we make a mistake with SIBO that we all only focus on eradicating SIBO, but it's like a running faucet. You have to turn it off. You don't want to just, you know, sweep the floor that has water on it. And SIBO is a motility disorder, so there's a reason why you developed it. It's not because of foods you ate necessarily. It's something about the vagus nerve, motility, valves, infections in the past, food poisoning in the past. So that has to be addressed. Visceral manipulation needs to be there, maybe stimulation of vagus nerve with either acupuncture, and especially eastern acupuncture, when you put electrodes in needles and you stimulate the needles where the vagus nerve runs. So visceral manipulation to regulate the valves so they close properly and things don't seep. Visceral manipulation also will help you find if you have adhesion, scarring, kinks in the colon, things are sitting, not moving, there's fermentation. So that all that needs to be part of your SIBO journey. And then with that, you do either herbals, medications, or elemental diet for 2 weeks, and you have to test and retest. It's very important. There's lots of pitfalls there. It's a breeding ground for pitfalls in treatment. So if you do that, if you understand where that SIBO is coming from, is that vagus nerve also toasted because the EBV is affecting it? Is that the beginning of your SIBO or something else? Because if that's how it is, we go upstream, then we work with the EBV protocol. So in terms of EBV protocol and SIBO, doing those protocols together, you could. That's not a problem if you work with somebody experienced. But diet is a problem because the foods that are perfect for EBV will tear you apart when you have SIBO because of the fiber component. That will bloat you, cause more distension and gas, and feed the SIBO. So in the paleo, autoimmune paleo, all these diets don't necessarily fit the research and the solutions I'm seeing with EBV. You can be a vegan and do EBV and thrive on it. You can be a vegan and do EBV and clear your Hashimoto's. I've seen that happen. Completely long-term sustainable. So the more antioxidants you have in your diet, the less inflammatory foods in general you have in your diet, the more raw material against EBV you get. So that's that big umbrella. There's something called NF-kappa B, that's inflammatory marker, and junk food feeds it, creates inflammation, and EBV hijacks those little markers. So the more of that you have, the more of the reactivation you might have. So that's a very different story from the whole paleo community, because you don't necessarily have to restrict a lot of food groups. More plants may be better. That's why Anthony William is so strong about having a lot of raw, his recipes are all about plants, because it's really appropriate. Now, if you have SIBO, your foods will not cause SIBO, and your foods necessarily will not make the SIBO worse. You already have it. And foods is just there. It's going to feed it more, so you're going to have more fermentation and more gas. So you're going to be more miserable. So that's the only reason why you restrict certain food groups and high FODMAPs in SIBO. But you also don't want to restrict too much. So let's say broccoli is high FODMAP, but if you have a little bit of broccoli and you're fine with it, enjoy it. A little bit of this, a little bit of this, a little bit of this. Sometimes it's much better. If you have 1 cup of broccoli, you explode, you don't do it. So you have to kind of track how everybody's different with SIBO, what you can tolerate. It's just tolerance. And there's food with fiber that are okay for SIBO. You can have quinoa or brown rice, and that oftentimes is well tolerated. You don't want to go low carb on SIBO. That actually is not sustainable and not needed. So there's some pitfalls there. Yeah, it's complicated and interesting. Much of the time of my work I do is a combination of those two. So I really feel for you guys if you have SIBO and EBV, because it's a lot of steps to kind of figure things out, but it's
Yeah.
worth it.
Yeah. All right. Heidi asks, this kind of goes back to what I said initially. Since I gave birth to my 2 children vaginally, does this mean they are doomed to suffer EBV chronic symptoms?
Nobody is doomed. Nobody is doomed. And I loved when Misty said, do not take the blame on you because you can't live in a bubble. You can get the virus from transfusion. You can get it from playing with kids. You can get it from kissing. You can't really be in a bubble. And most of us carry it. So there was a case. A friend of mine was reading the book, and I want the moms to hear that story. Um, and she didn't tell me that until after the fact. So she said, the more I read the book, the more I thought about my niece. She's 2 years old. She's failing. She's falling. She's, they're diagnosing her here and there, and nobody knows what's going on. So before she even talked to me, she said, she talked to her sister. Her sister asked her pediatrician to test EBV. The test was done properly, and the diagnosis was severe active chronic EBV at the age of 2. So she went back to some of the recipes, simple things, foods, and by the time she talked to me, which was like within a week, she says she's walking, she's not falling, she's doing better. And so I have goosebumps when I say that, because what it means, she was just a little angel. I mean, she was such an adorable little girl. So what happens is, well, she had a severe form at 2. Imagine, the brain is developing, the tissues are developing at 2. She was so infected. And they already turned it around with simple licorice. They were doing some other things. Food, blueberries, green tea. They just went for it. Within days, she turned around. And now they have the book, they have the knowledge. They know in future, and I told her specifically, you may have prevented cancer when she's 40, 50. You may have prevented Hashimoto's, autoimmune disorders, lupus, rheumatoid arthritis, chronic fatigue, because from now on, you'll always teach her. She'll always know what to do. If anything's stewing, she's going to zap it right there. It will never come to fruition. That's huge. So I want all the moms to know it's all totally possible. Dr. Flavin, I posted the link in the thread for us with her study, 2006. I actually tracked her down in Germany and we hit it off. What a wonderful woman. She did a study on 50 kids and young adults with enlarged spleens. Enlarged spleens are dangerous. That's really acute mono. They can burst. They are very dangerous. So there is specific protocol that she used, I think 6 different things with dosages for the kids and the young adults. So that gives you some ammunition. You can look it up here. And she was able to reverse and basically cure mono within 24, 48 hours. Took pictures of spleen before and after, just like I said with that little girl. So instead of worrying, instead of being guilty, you have all the tools. You have that beautiful study. We will have EBV Summit next year, and Dr. Flavin, I already hooked her up with a host. We're going to have her speak. I can't wait for America to hear who she is, because she is amazing, the best kept secret. It's a great service because she proved that it is so fast. So you have all the tools. You don't have to worry. You just have to learn it. Read it, learn it, notice, and you know what to do.
Awesome. All right. So Rose asks, I have tested positive for non-active EBV. I also have thyroid nodules and Hashimoto's. What would be the best protocol to follow? I would love to eradicate it as slowly and gently as possible. And I kind of want to preempt this by saying you've outlined all of this in your book. And it's going to be really hard in a conversation like this to give you the whole protocol, but go ahead.
No. Well, first of all, when they say it's not active right now, did they test early antigen? Do you have a history of early antigen being tested and retested when you felt good and when you felt crappy? So where are you now? Are you feeling really awful? Is that the time to retest early antigen? we don't know what they tested and what they didn't. Sometimes they only test two things, just like with the thyroid, you know. With the
Mm-hmm.
thyroid, you should retest antibodies every single time. I have a woman who's meticulous, like over the top testing things, and every time her TPO is normal, but it's increasing a little bit. Think about that. And he has EBV, so um, just learn how to request the right labs and interpret them yourself. There's a huge chapter in the book, but there's also a huge page on that website I mentioned, EBV Help. So you can kind of look at your lab and look at it and analyze it yourself. You can do it. And with the book and that page, you'll know probably more how to analyze it than currently the doctors, because they just go run quickly and they're not thinking about all the permutations.
Yeah. And she also asks, is there a safe kids protocol?
That's why I put Dr. Flavin's study, because it is a study, it's published, it's right there. It was acute. She did the dosages for kids and young adults. I would say the protocols, the max doses that I mentioned, I would cut them and use 1/3 maybe for a kid. Also follow any counterindications that I list and start with the 5 big ones: NAC, lysine, licorice, selenium, zinc. Dr. Flavin was using vitamin E and vitamin C. These are, of course, these are big. I have them too. So pick and choose a few. Not much is needed sometimes, and for kids, you may be surprised. So just tweak it and pick some, and maybe work with your doctor on picking the right ones if the doctor knows your kid well.
Alrighty. Next question is from Alice. I have EBV. Should I get the flu or pneumonia vaccine?
I don't really want to go into vaccination issues because it's a complicated issue and complicated story. I do mention one connection with vaccinations that come from eggs or from the protein material from eggs, hens, and I know that may affect immunity later, especially if vaccinations are for viruses. Like I said, one of my patients was vaccinated for hepatitis B and had severe hepatitis B, almost killed her liver, and it took years to recover. It's still iffy. She just developed it after. So one of the best remedies naturally that we have, they're extremely well studied. You can just PubMed it, it's overwhelming and very predictable, is that the better status of vitamin D you have, the more protection you have against flu. And statistically, I see it as at least as good as flu shots, but flu shots hit and miss. The flu evolves, and vaccinations are what they are at a given time. So even people that get vaccinated can get flu. It doesn't guarantee that you're not going to get it, but the vaccinations themselves, let me put it this way, I'll never vaccinate myself for flu personally. I don't need to. And one of the reasons I decided not to pursue my career related to hospital work is because I just didn't want any vaccination. But that's just me.
Yeah. So one of the things I'll say just for women to contemplate when it comes to the whole vaccine argument in general is you have to remember that every time you're getting vaccinated, they're actually putting a little bit of it in you. And if you've got immune issues already, logically, what comes up for me and what I'm hearing when other people are talking about this is if you've already got issues with your immune system being overly activated or really sluggish, continuing to vaccinate for other things is a stressor on your immune system, and your immune system is already compromised. So I look at it really logically, and do I want to further add a load to my body when I'm already feeling the effects of a compromised immune system? So I personally wouldn't choose vaccination. And I think I'm not necessarily anti-vax. I think you have to look at your unique situation and consider the effect that decision might have on you. And is it Like the flu vaccine in general, like it's so hit or miss. Like they come out with these vaccines that don't really even help the statistics behind it and look at it in comparison to everything else that you're learning about how your body works as a woman and use your intuition to make that choice.
Yeah, well said. There's an article I wrote on EBV Help website about eggs. If you want to pull that blog and read, there is some research and some concerns about vaccinating in relationship to eggs, egg protein, and autoimmunity. So I reference some study there if anyone wants to read more. But yeah, it's a tricky area.
Yeah. All right, next question is from Deliverance. I have had reactivated EBV for at least a year. I have been on a low dose antibiotic and a high dose of vitamin C, and it's not working. My numbers are still sky high. I have Hashimoto's, and after a brief time of seeing my antibodies get a little lower, they went back up higher than they have been since my diagnosis. I was doing strict AIP, then reintroduced to almost paleo, but now my nurse practitioner wants me to go back to AIP. Is any of this going to work? I am so frustrated.
Okay, it is very frustrating because, like Misty told you, antibiotics have no bearings on EBV. There may be co-infection like strep, which is not uncommon, other pathogens, but if you want to do antibiotics, you want to do a stool test and see if there's any pathogenic bacteria that you are actually killing, because you're actually killing your immune system. So the terrain of your immune system is terrain right on your gut lining. And this gut lining should be populated by a biofilm of good beneficial bacteria. These bacteria talk to your immune system, they regulate pH, they regulate pathogens, yeast, everything needs its place. They create butyric acid, which feeds your colon cells, but also seeps into the bloodstream and actually feeds your Tregs. The Tregs regulate your autoimmunity, prevents the bad T regulatory cells. Other T, like T17, is a potential trigger for autoimmunity. So they can downregulate the other bad guys like a superhero in your bloodstream. And it needs that butyrate, but butyrate comes from your good bacteria. The good bacteria need fiber. So that's more of the roughage from plants. Not so there's no fiber, and none of that happens if you have heavy meat-based diet, because or fish, there's nothing there to feed them, or dairy. So where were we going with this? Yes, antibiotics. I don't understand the logics behind it. It's like shooting in the dark. This really is pointless, but it's hurting your microbiome. So you just ruined your immune system that was in the gut, and now you have to repair it and nourish it again, bring it back, which takes time. So then your immune system will improve and can fight the EBV better. So with Hashimoto's, I know that there's different diet restrictions for Hashimoto specifically. Books have been written about it, but I have to say, if Hashimoto is driven by Epstein-Barr, and that's the presentation, then you don't necessarily have to restrict so much and get into a Hashimoto diet. I've had a woman that is vegan, and we did it completely with plant-based diet. Her Hashimoto's became normal. She has no more problem, and she's completely functional again, happy, depression gone. So take a look at the book and the ideas, and see if you can tolerate these foods. Everything depends on the foods you tolerate as well. But you have to rebuild your gut. You have to recover. This is not good, the antibiotics. If you are on medication like Thyroid or Synthroid or MP, if it's driven again by a virus, then you can have a honeymoon period when you feel better, but then, like you said, then you don't, because it's a square peg in a round hole. They don't fit. The thyroid is still being attacked by the immune system because it's going after EBV, which resides there. And basically, it's not because the immune system is stupid, but if the cells in thyroid are infected by EBV, it's inside the cells. The immune system has no choice but go after the cells, kill the cells, remove the cells, jump on the cells because they need to be terminated because of that EBV. So that's the damage. So the triggering factor has to be removed. So that would be the bigger one, the EBV, if that's what it is.
Right. Yeah, I actually left a comment on that one similar.
I know. Yeah,
fact,
I read that.
fact, you don't treat a viral infection with an antibiotic. It just doesn't, like, that's
No, so there's no
not, and I don't like, that would be a tell for me that I needed to find a new
change a
doctor. Do not
practitioner.
have
Yeah.
to, do not collect $200 because I can only imagine a really uninformed, uneducated doctor, and I mean that with all due respect, when it comes to this area, giving you an antibiotic to treat a virus.
I think it's a liability. It's incompetent, and it is completely wrong. So I don't know how it even happened. It shouldn't have happened.
Yeah. Yeah. All right. So the next question is, what is the best diet protocol for treating Epstein-Barr? And I know you've kind of touched on this.
Yeah.
Do you think there is a best? Can you make a variety of these diet paths work? Is the important thing just getting the right foods in the diet?
So I did make a statement in the book that I'm not gonna create my diet, or I'm not gonna call it a diet. There is no diet. What works the best, it seems, is whole foods, unrefined, with every element phytonutrient you can find. And I really appreciate Anthony Williams stressing going back to wild foods like wild blueberries, um, antioxidants, and anti-NF-kappa B constituents, uh, curbing the free radical and oxidative damage. This is really where you win. Antioxidants that are part of the EBV protocol are vitamin C, vitamin E, vitamin A, right? Antioxidants, selenium, antioxidants. So really enjoying real foods, not necessarily going into a diet mode, just tweaking what you're eating, but preventing chemicals, because chemical exposure, environmental exposure, that's triggering points.
Yeah.
There was a study on NF-kappa B when just one meal in a fast food joint increased NF-kappa B by 150%. So three folds within an hour and a half or so. And so that one meal could literally be a factor in retriggering your EBV if there's also terrain when you're already compromised. So it's just the quality of foods, and fiber roughage to feed the T-regs, like I said, to feed the microbiome so they have something to eat. And you're not getting that roughage from meat, dairy, cheese, eggs. There's nothing there for them. Soda. That's going to starve them. So that's going to compromise your immune system. So if you look at it this way, just more whole foods, really. Not that complicated, but good quality and organic. Because also, one thing I have to mention with diet to everyone is, if you look at studies, just if your nutritional status decreases, so you have more nutrient deficiencies, your virus becomes more virulent. So it becomes stronger, just like a selenium deficiency. Then suddenly it becomes a problem. So there's a lot of studies, and I had to quote some because people still ask me if organic produce is just an expensive fad. No, it's not. We are losing nutrient density in foods from commercially grown produce. We are losing because the topsoil is dying, it's not nourished, and the plants all only are as nutritious as the soil they grow in. So, the organic farmers tend to the soil better, and then it's, of course, has the minimum pesticides. They're not pesticide free because it's not a glass house, like it's not a bubble. There's still water and wind and rain. You get contamination, but it's really important to invest in organics to maximize that nutrient status.
Alrighty. Heidi asks, wait, that's a repeat of the same question. Next question. Barbara asks, My son is 11 years old and he has EBV, unfortunately. Can I use your protocol for EBV for him? What about dosages? And you pretty much already addressed
Yeah, so
that.
check Dr. Flavin's study that I linked there. There she goes through specific protocol with the dosages for kids, or you can do 1/3 of what I recommend acutely, and I think that would be safe. Just watch if he does better or not. With the supplements in my book, especially starting with the 5 big hitters, there should not be side effects, Hox reactions, die off. You should just feel better. So if he feels worse, one of those is not working. Maybe he's sensitive. Maybe it's not a good fit. Okay.
All right. Can you address the relationship, connection, or susceptibility of EBV, herpes, shingles, etc.? I saw all of them on a graphic about EBV. I didn't ask you that question, did I?
Nope.
I keep reading it, and there's like I'm having this deja vu moment of, did I not say that one out loud? I don't think I said it out loud.
No. No, they're herpes family, and they hate the same thing. So the beautiful thing is, I started, I remember reading Anthony Williams actually information and audio on herpes because I was really blown away. Like, could we really work with this? And of course, there's no research anywhere or no schooling on it, and just so I actually pulled before I did the book, I pulled his protocol out, and basically it's very similar to what I do, all based on research and what delivers. And the interesting thing is I had a friend with shingles. Within the first day of diagnosis, she decided to just jump in with me, and we did an acute, and it was pretty much EBV, acute EBV. That's what we did, cleaned up. And within a week, she was symptom free. She turned around, and that's long term, never happened again. And she knows where to go if it happens again. So they hate the same thing. So that's the fascinating thing. It's herpes family. The little herpes, that's the easiest. Sometimes you just need a lysine for that one. Even sometimes have 500 or 1,000, but that's a low dose. But sometimes that's enough. But the problem is with when one reactivates, and you have all of them, depending on circumstances and how bad you are with your diet, with your sleep, with your overwork, stress level, that there is a concept called transactivation when one infection pulls on the other. So if you have a little herpes, you don't want to redevelop your EBV or vice versa. But that goes across species, so it doesn't have to be viral. It could be strep, it could be fungal, one pulls another. It could be both direction. EBV can trigger your old strep, or your fungal infection can trigger EBV. That's where I see if the protocol is not working, that's where I see complications. If there's fungal infection, toxic molds, or electromagnetic field exposure, something else is preventing the protocol from hitting the virus. There's something ongoing that is also confusing immune system, affecting it.
Yeah. Alrighty. That's about a wrap. I think we've got all the questions in right at an hour. Nice job.
Yay!
Thanks everyone for joining us and asking all your questions. And thank you, Dr. Kasia, for spending time with us and sharing so much about who you are. You've been so active in the community too, supporting everyone that has questions. And I appreciate that. I know so many women appreciate that. My perspective, my belief based on my experience with this is that if you're a woman dealing with flabby, foggy, and fatigue, you likely have Epstein-Barr. And so it's really important that you have this education, that you know what tools will work, what you can do to actually, corral this and get it under control. And I'm super excited that we found you right as you're wrapping everything up. It's so perfect. The universe is smiling. Yeah. God said this will happen. So it's great.
And you will get it, right? Be careful.
That's all right. Well, thanks everyone for tuning in. I'm really grateful that you are spending time with us, that you trust us to support you, and I'm honored.
Oh my
I'm honored
gosh.
to be great practitioners to all of you, and I want you all to be radiant Rosies with me. I want you all to have an amazing quality of life.
Okay, you guys, Misty is officially an EBV hero. I don't know if you can see this. We have a manifesto. It is on my website. You can pull it out and you can print it, put it on your refrigerator.
Yep. frame it and put it on our own wall.
We refuse to be victimized by EBV.
Yes.
We know both pain and fear, and we embrace them with compassion, but we have chosen to move forward from that dark place because we believe recovery from EBV is possible. We have given ourselves permission to heal. We believe our body is our best ally. We commit to loving and supporting it, and on and on. And we are against being marginalized and dismissed by the medical community. We are the agents of change. You ladies, go get it. Bringing this truth to our doctors, pushing the shift in the medicine, ensuring that the future generations, our daughters, our sons, do not have to suffer like we did. And there's more to it. I want you to print it, enjoy it, and know that it's true.
That's right.
Let's make that better.
That's what I want for every single one of us. We are empowered. We have the knowledge and resources that we need to change our life. And so thank you again.
With your amazing event is so helpful, so beautiful, and so healing. So thank you for putting it up and driving it.
Thank all of you for tuning in, and we'll have another Ask Me Anything in a few hours. So have a good day, everybody.
Have fun. Thank you. Bye. Good luck.